I had fun drawing these guys. These little bacteria running down a central line right into the bloodstream. In my head, they're just sliding down this thing, just making little noises going yang, 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 yang. Anyway, let's talk about CLABSIs really quick. CLABSIs are central line associated bloodstream infections. Recognizing and managing CLABSIs are a big part of nursing. How we recognize CLABSIs, our patients will have fevers, rigors, increased white blood count, especially with somebody with an indwelling central line for greater than 48 hours. If a CLABSI is suspected, you're going to tell the doctor, and then they're going to order the lab to obtain a dual blood cultures, one in the peripheral, one at the CVC. Next, you'll most likely receive an order with empiric broad spectrum antibiotic, and then you and the team are going to consider removing that catheter, especially if there's severe sepsis noted, a tunnel infection, or those blood cultures come back with bacteria such as Staph aureus or a fungal growth. Part of the CLABSI prevention bundle includes a full sterile barrier when introducing a central line, having the doctor choose an optimal site such as the subclavian or the IJ. The femoral can be used, but it's pretty dirty down there and it increases your risk of CLABSI. So we do try and stay away from them, but they can be used in emergencies. On a daily basis, you're going to assess your need for that central line, and if no longer needed, you're going to do a prompt removal. The central line is always going to be covered with a transparent dressing with a CHD disc or patch, and don't forget to scrub the hub for 15 seconds. I like singing myself "Mary Had a Little Lamb." It helps me dissociate from the screams, beeps, and alarms I hear on a daily basis. You're going to replace that IV tubing every 96 hours. If you're infusing TPN, it's every 24 hours. And if you're keeping somebody sedated with propofol, you're going to change that IV tubing every 12 hours. And finally, you're going to use closed lumen needle-free connectors. I hope this helps. Feel free to drop a comment and let me know what you think these little guys sound like in your head.